I'll be presenting today's Radiopedia.org case in radiology, glioblastoma with coagulative necrosis due to bevacizumab. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 50-year-old male who presents with the seizure. Taking a look at the MRI of the brain, we note that there's an ill-defined mass involving the medial and superior aspect of the right frontal lobe, with mild mass effect. Here on FLAIR, we note minor patchy enhancement present posteriorly, correlating with reduced ADC values. These features are those of a diffuse adult glioma, most likely grade 3 or 4. The patient went on to have a resection. Pathology revealed glioblastoma grade 4. Taking a look at the MRI of the brain post-op day number 1, here the sagittal view with contrast, we can see the resection cavity with possible minor residual tumor posteriorly within the supplementary motor area. For reference, here is the pre-operative MRI. The MRI of the brain 7 months post-op, we note previous bifrontal craniotomy and underlying resection cavity in the right frontal lobe, with associated post-surgical changes. However, there's a nodular contrast enhancement at the posterior inferior edge of the resection cavity, which has markedly increased in size over the last 2 studies, which are not shown. There's also new foci of enhancement in the genu and the body of the right corpus callosum. Some of the enhancing components demonstrate low ADC values and are associated with an elevated CBV. Spectroscopy demonstrates decreased NAA, elevated choline, and a lactate peak. In conclusion, there's an increase in size of the enhancing tumor and surrounding high flare signal, 2 new enhancing nodules in the corpus callosum, and low ADC and elevation of RCBV in the new enhancing components suggest disease progression rather than treatment effect. The patient was commenced on bevacizumab with symptomatic improvement. The MRI of the brain 14 months post-op, the patient has been on bevacizumab for 5 months. Adjacent to the frontal horn of the lateral ventricle is an area of diffusion restriction with a profoundly depressed ADC. This is consistent with an area of coagulative necrosis secondary to bevacizumab. Coagulative necrosis occurs in patients on bevacizumab, which is an antibody to VEGF, and has an incompletely understood and variable effect on prognosis. It can be thought of as a variant of, or at least to be mistaken for, tumor pseudo-response. Tumor pseudo-response is a phenomenon of tumors appearing to respond to a specific treatment on imaging criteria when the lesion actually remains stable or has even progressed.